welcome back to my channel. This is just a really quick case. I just want you to see how the appreciation that you see on the fracture tube. A typical problem with a fracture tube symptom is that patient will complain about bite hurt when they bite something, and so. My patient haven't seen me for a while, and he came here today. Tube number 5, you can see the amalgam, MOD amalgam, and look at the fracture behind the MOD amalgam. That the piece of cust that is fracture. So in this particular case, the buccal cust seem to be fracture farther down, and I measure the perio probe and also do some testing. Now, one of the reasons that is contribution for this fracture is that the patient on the x-ray, he did have root canal, but he didn't want to get the crown done right away. And this is what happened. The tube is fractured. So when you have a root canal, you must have a crown, otherwise it fracture. When it fracture, it's too late to save. The tube no longer is savable. This required for extraction. The other thing about his situation is you can see that whenever you're missing the back teeth, in dentistry we call posterior teeth, then when you eat, you're gonna be using more force in the front. The more you're using the force in front and the middle tooth, the more risk for you having a fractured tooth, especially when you don't have a back teeth. Back teeth is important for chewing. Front teeth is important for biting on something. But to break down the food, you're using the back teeth. But you don't have a back teeth, you're gonna be using more front teeth to yield the function of the back teeth, which is no good. So we encourage the patient whenever possibly you save the tooth by having a root canal, and you have to have a crown done right away on the back teeth. Otherwise, the more missing back teeth, the more risk that you're going to lose more front teeth. It's a consequence of lack of balance because you're now using more force in the front, less force. There's no force in the back because not a lot of teeth in the back. So again, this video for just an example for patient and also young dentists, recommend you to encourage the patient to save back teeth, save back teeth as much as possible, do root canal, save the tooth, do gum surgery if needed, save. The more you save the back teeth, the less problem in the front teeth that you're gonna get. The more you ignore the doctor recommendation, the more you don't talk to your patient about back teeth. What happened is whatever you done in the front tooth, it will come to the answer at some point. That potentially more breaking in front teeth after the back teeth missing. So again, please encourage everyone to save back teeth. Thank you for checking in this channel. I'm hoping it's useful, and see you guys next time. Take care. Bye bye.